I'm Donna Rauen, and I'm here to represent the state of Washington. I would like to ask for some federal funding to help deal with the pertussis outbreak. As you have probably seen in the news, there has been a rise in cases, and it is causing some serious problems. This was once known as a childhood killer, and we do not want it to become that again. With some federal funding, we have come up with an integrated marketing plan that we believe will help solve the problem. I hope you enjoy our video and find it informative. Pertussis, commonly known as whooping cough, is caused by bacterial infection that produces intense fits of coughing. This bacteria attaches to the tiny hair-like extensions that line the upper respiratory system. They then release a toxin which damages these hairs and causes swelling. Pertussis can lead to pneumonia, seizures, brain damage, mental retardation, and even death. Before the vaccine, there were 200,000 cases of pertussis annually in the United States, with about 8,000 deaths from the disease yearly. In 2010, pertussis was declared an epidemic in several states that were experiencing high numbers of cases that resulted in the deaths of numerous infants. Our state would like to be proactive to prevent the deaths from occurring. The immunization is among the greatest public health achievements in the past 100 years. There is a way to help prevent pertussis, and it is through vaccination. The vaccine is not 100% effective, but it does help prevent the vaccinated person from developing a severe case. Immunizations expose us to a very small but safe amount of the infection. This exposure lets our bodies help build a immunity against the disease. They are known as inactive vaccines because they do not contain a live bacteria and cannot replicate themselves, which is why multiple doses are needed to produce immunity. This immunization can help prevent the spread of the disease. Our goal with this federal funding is to increase vaccination coverage among postpartum women and their families to 90% in the state of Washington. We plan to develop the task force to develop these strategies and implement them. The task force will review current data, research practice, and develop recommendations for the plan. These recommendations will include reliable, up-to-date immunization coverage for the state. We will educate the public about the value of being properly immunized and maintaining those records, and inform local policymakers about the coverage rate and encourage them to support improved state immunization laws. Our target audience will be postpartum women and their families. 90% of pertussis-associated deaths have been among babies less than 1 year of age. The response will be initiate a standing order of immunizations and provide information about the vaccine to all postpartum families. If the family member receives the immunization before leaving the hospital, then it will lower their chance of getting pertussis and spreading it to the new baby. There was a study done in Texas called the Cocoon Strategy, which aimed to protect newborn infants from becoming infected with pertussis by administering the booster vaccine to mothers and family members of newborn infants. This made a difference, and we plan to implement the same type of strategy here in Washington State. This program allows us to educate and provide the vaccine to adults and family members, which will protect the most vulnerable patient. The goal of this marketing plan is to outline the marketing strategies, tactics, and programs possible to administer the vaccine in order to protect the most vulnerable. The vision outlined in the plan includes enough vaccines to administer 800,000 vaccinations during the first year, which will allow us to increase the vaccination rate to 90%. The average cost of each vaccine through the Center of Disease Control is around $14 for pediatrics and $21 for adults. We will continue to research the effects in cases of pertussis. We will continue to poll customers in order to monitor the effects of the vaccination and performance of the plan, along with trying to find new ways to prevent the spread of the disease. We will implement this plan in the hospitals across the state for the next year, starting in May. We will follow the number of cases and injuries and even deaths associated with the disease to ensure our plan is working and making a difference. We will continue to hand out pamphlets and educate the public on the damages and the importance of vaccinations. We believe our marketing strategy will help increase the motivation that pertussis is a perceived threat and increase the public involvement. We believe it will protect the most vulnerable. By focusing on postpartum women and their families, it will allow us to create awareness around our issue and educate our target population. It will give us access to them during this time of need. We will focus our attention on educating them during this intimate time and educating them ways to protect their loved one. They will have access to the vaccine with this federal funding along with access to resources. Thank you for your time, and I hope you enjoyed our video.